Welcome back. Research into women's health still lags behind men's, especially when it comes to heart attacks and the life-saving surgery often needed to save people's lives. For the record, women have a higher risk of dying after coronary artery bypass surgery, or grafting known as CABG, than men. That is according to a recent study in JAMA Surgery and other research too. Scientists found women have a 2.8% mortality rate after the surgery compared to men at 1.7%. And that may not seem like a lot, but when you factor in women are only 25 to 30% of CABG patients, then the risks become clear, right? The study, by the way, also found 20% of men experienced post-surgery complications compared to 28% of women. So it's really through the procedure and after that we're seeing this trend. So joining me now to discuss is Texas cardiologist Dr. Fahmi Farah. Welcome back. I, off the top, am just kind of like, we have this information. Are doctors aware of this risk? And if so, why are we still seeing this as an option for treatment? What kind of situation has to be at play for the doctor to say, I'm going to risk this anyway?
It's a very complicated procedure, of course, and the studies that you've mentioned, of course, it's alarming. As a whole, in the cardiovascular world, we've known that women behave differently. We don't know the full story behind why that is. The complications are so much higher. But yes, there is a very specific scenario when we choose a woman or men to take them to cardiovascular bypass surgery as opposed to just putting a stent in. They typically have to have very significant blockage burden. Typically, at least 3 major arteries have to have more than 70% blockage, and typically one of them has to be the widowmaker, which is the main artery. And we do have survival benefit when we, especially in diabetic patients, when we take them to do bypass surgery as opposed to stenting. So yes, these patients that we're taking for open heart surgery, they're well vetted, and the intention behind this is to help them not just with survival, but also better life quality afterwards.
It's really important to hear the context, and I wrote it down: 3 major arteries with at least 70% blockage, and a couple of other factors playing into the decision-making of doing this type of procedure. Because, from the flip side, you're a woman, a patient, who maybe you're realizing, oh my gosh, I'm having a heart attack, you're feeling it kind of going down your arm, which is different than how a man would feel it. And as you're being wheeled up, are there certain questions, and it's tough with the timing, because timing is of the essence, as you know, when it comes to this, but is there something that patient should say to the doctor and confirm before proceeding with a procedure like this, or maybe that a family member can interact with the doctor and make sure that everything's squared away?
Oh, absolutely. Before we take somebody to an open heart surgery, there are a number of factors that we take into consideration. Like, one of them is family support and the recovery. All of that is taken into consideration. I will say, though, one of the reasons why we see higher rate of complication and death after a surgery like this is because women tend to have more complications before even they go into the surgery. One of the reasons is because their care is delayed a lot of the times. Often because they don't realize they have atypical symptoms. That's one. And the other is they tend to have higher risk factors. Their diabetes is typically not as well controlled as their male counterparts. Often their high blood pressure has been there for a long period of time and it went undetected, so they have higher cardiovascular damage in comparison to their male counterparts. So there are many complicated factors that go into play here that's contributing to these bad statistics. But more research definitely needs to be done in women, because for a very long time, women were ignored in the cardiovascular world, so to speak. For a long time, it was known to be men, male predominant disease, but that's clearly not true. And we need to allocate a lot more resources to research to finding out why that is.
Yeah, and just that kind of gives me a perfect segue in my final question for you, just to really double down on the information that we do know now at this point about women. Can you just share with our viewers, what are the symptoms if a woman is experiencing a heart attack? What does that look or feel like?
Yes, it can vary. And, of course, the classic symptoms are crushing chest pain, shortness of breath. But in a woman, the atypical symptoms may not even have any chest pain at all. Often it's indigestion like symptoms. It could be very severe indigestion that's different from prior indigestion symptoms. They'll have profuse sweating and a heavy breathing, a lot of shortness of breath. Often people describe it as an elephant sitting on their chest. Those are your pretty ominous signs that you should seek help.
All right, cardiologist Dr. Fahmi Farah, thank you so much for helping us understand the risks for women, where the science stands on this, and how much there's more to go on it. We appreciate it.
Thank you for having me.